Well, we have been hit with more sobering milestones in the coronavirus pandemic. More than 700,000 people around the world have died because of this virus. Here in the U.S., here's what the numbers look like. Nearly 1,400 deaths were reported yesterday alone, and at least 1,000 fatalities were recorded on 7 of the last 9 days. Okay, so 1,000 a day. That brings the death rate up to an alarming 24% in the last week. But here is maybe some good news. In that same 7-day span, also, we saw a 9% decline in new infections. More than 57,000 new cases were confirmed in the U.S. on Tuesday, bringing the total nationwide closer to 5 million. So, to talk more about the latest news on COVID, the medical developments and other things, we want to bring in Dr. Bob Lahita. It's always so good to talk to you, Dr. Bob. Let's get right into some of the therapeutics that are making headlines. COVID patients who are receiving blood plasma transfusions that are rich in antibodies seem to show a lower mortality rate. That's the good news. But like what we have seen happening over and over again is as soon as there seems to be something positive about a therapeutic, then the demand increases and there may be a problem with getting this plasma to the people that we need to get it to. And so that could also have an impact on the outcome of these studies. So what can you tell us about the use of antibody-rich plasma?
Okay, Anne-Marie, thanks for having me, and I'll explain that. It's a little bit complicated. We are in the throes of a research project for hospitalized patients. So this plasma is only useful in patients who are acutely ill in the hospital. Now, the problem is we have to identify people who have recovered from COVID-19 who have high levels of what we call neutralizing antibody. That's an immunoglobulin that neutralizes the virus. And it is produced in copious amounts in people who have been infected and have recovered. Now, you have to go to an area where that can be removed from your body as an antibody, purified, and then reinfused back into a person who is acutely ill with COVID-19. The data that we see is that the mortality based on infusion of these purified antibodies into patients who have COVID-19, the mortality dropped by 50%. It went from 7% mortality to 13% mortality. It went from 13% to 7% mortality, which was basically halved. And that is incredibly positive data. The problem is there's no control study here because everybody's getting the neutralizing antibody when it's possible to receive it. We've had problems identifying patients with high titer antibody, and we've had problems in them going to a blood bank and getting pheresed, that is the removal of their plasma. That's the non-blood cell part of the blood, and then it gets purified, and then it gets sent off to the hospital, and that's infused into patients that are very, very sick. So it's not an easy process. It's something that's been around for almost 2 centuries, and that is getting acute antibody that is from a patient convalescing into a patient who is very, very sick.
Mm-hmm. So one of the things that I think is so confounding about this virus is that it feels like you just don't, if you get it, it's a crapshoot. You don't know how severely you're going to be impacted. I'm not talking about people who are most likely to die. We know that underlying conditions, older people, their mortality rates are higher. But I see people who are pretty sort of young and healthy, and boy, this virus takes them out. And even after they've kind of gotten over the sickest part of it, they still seem to have issues afterwards. So there are studies now shedding a little more light on who is most likely to suffer the most should they contract this virus. What do we know?
What we know is that the body responds to a viral infection in a very interesting immunologic fashion. I'm going to make it as simple as I can. There's a substance in the patients called interferon. This is something we've known about for decades, and interferon always goes up when somebody is infected with a virus. There are people who don't have, for reasons that may be genetic or otherwise, appropriate levels of interferon as a result of the virus infection. Now, that being one thing, what's going on and what has been reported is that the immune system in the case of COVID-19 infection goes a little berserk. Generally, there's a very orderly process. There's something called the innate immune response, which is a rapid immune response that happens once you're infected, followed by a couple days later, an adaptive immune response, which means that's when you get the antibody, the protein against the virus, and that's when you get the cellular response. Now, that is usually divided, at least in the article that I read, into three levels. One is a viral response, second is a parasite response, and third is a fungus bacteria response. Most patients have just a viral response, but in some patients who are very sick, the immune system goes a little haywire, and all three of these responses go into effect. And the substance that's key here, and there are about 200 versions of this, the substance that's key is called a cytokine, and that's a communication molecule between the cells of the person's body. These cytokines are raised tremendously. And some people you've heard, and I'm sure your viewers have heard of cytokine storm. That's where the cytokines are really haywire and are at a very high level, and everything in the body is activated. So you get lung failure, heart failure, kidney failure, patient has strokes, body problems, etc. That's the problem.
I see, because, and as I understand it, part of what the patients are fighting, they're fighting their own immune system, basically,
Correct.
that is kind of overreacting to the virus. Is that a really basic way of kind of
Marie, what
describing it?
that's what I tell the residents. I say, it's not the virus that kills you, it's the immune system's response to the virus that seems to be devastating and organ destructive.
Yeah, it is confounding. Doctor, we could continue to talk to you, but we're running out of time. There's so many other things happening. The list of symptoms seems to keep getting longer and longer. It's increasingly more difficult to identify whether or not you have had this and before, because before it was just a cough and a shortness of breath, and now there are so many different symptoms. But we got to let you go, Dr. Bob. I know we'll talk to you again next week. Thank you so much.
Okay, thanks, Anne Marie.